Hi, good day everyone. Welcome to another episode of Let's Make Fair. I want to especially welcome you. I know today's Monday, we've all had a very busy day, and I want to believe your day has been going very well. I want to appreciate you all for coming on tonight again to be part of the show. Like I told you on Sunday, it's going to be like on Saturday night, two episodes. We're supposed to have Mrs Adebukola Adekanyinsola online on Saturday worship. Actually chose Monday to be part of the show. And I want to appreciate you all because some of you actually asked how far when she coming. Now she's in the house. I want to thank you for your support. You know, Let's Make Fair is now beginning to be like an household name in the online media in the city of Lagos. And if you guys are not there, you will not be able to be going on. And I want to thank you for your support all the way. And looking at the topic tonight, the impact and influence of coronavirus pandemic on our health system. Coronavirus is no more news in Lagos, in Nigeria, in the whole world. The word coronavirus is now becoming like a culture. You must abide by it, and there is no way around it. At the point when it came to the city of Lagos about March, so many people were like, it's not real. At the point that there's this gist on it's a big man disease. Some people even say jokingly that how will they contact coronavirus when they've not flown out of the country? And now it's no more looking like a big man disease or a rich man illness. It is called pandemic, and when you hear the word pandemic, it's a serious issue. I want to know and believe that this time I don't need to tell you what the virus means anymore, because now you know. And this has actually shaping our society to a place where we must not gather again. Church has been shut down, schools are off, and people who have events, weddings have been forced to have it in a new way that we're not actually used to. Aside from that, the numbers of people that have been caught by this pandemic, infected by the disease, by the virus, and the numbers of deaths keep rising every day by day. Now we are now in it. We're beginning. There's a change in society. The health system has been affected. Some people now do not want to go to the hospital because they say when they go, they will say they have coronavirus, and they settle for self-medications in the house. And this has increased the number of deaths outside the virus. People keep dying of the virus, and people also die of self-medications in their home. And this has brought us to this conversation with professionals who are actually on the front line handling this issue. And today, like we had Dr. Shegun on Saturday night, today we'll be having in the house a very stressed and overworked friend. I will be doing that, thank you later, has worked all day. She's very tired, but still she's taking out some time out of her busy schedule to be part of the show today. But she wants to educate everyone, and that I think to her is a topmost priority. And that's why she's going to be joining us all the way from the United States to look at this issue, the impact and influence of coronavirus pandemic on our health system. I want to encourage you all right now that are online watching us to share this video with friends, share the video, gather around, let's be part of this conversation. If you have any questions, you can send it on the comment button. And believe me, Adebukola Adekanyinsola will be right in the house to address this matter professionally. Please join me as I welcome tonight on OFE TV on Let's Make Fair, Mrs. Adebukola Adekanyinsola. Good evening, ma'am.
Good evening. How are you?
Anyway, don't let me say good evening. It's good day because here in Lagos it's evening, but over there it's not evening.
Over here is 2 p.m. afternoon, and you keep addressing me as Mrs. Adebukola Adekanyinsola, and I'm just like, okay. Oh, okay. Okay, but anyway, thank you for the honor. Thank you for having me.
You're welcome. Now, let's meet you. Maybe I'm actually missing out some lines in that introduction. Please It was sweet.
You're not missing out any line. You get it, except for the Mrs. and Mrs. Okay, I
Okay.
mean Mrs. But okay. Do you really have to say Mrs.? Why can't you just say my name? Bukola Dantis, actually. Adekanyisola is just a name I made up. It's not even my, I mean, a name I made up, but, Dantis, Adebukola Dantis. Yeah, that is my name. But it's been a long time since we've seen each other. So it's like, I don't know what's going on in your life. You don't know what's going on in my life, except for when I post picture on Facebook. But that's okay.
You're welcome. I'm
Thank you.
proud
Thank you for
of
the
you.
honor. Thank you.
So let's go into the business of the day. There
Right.
was some times ago we had you on our show and you actually gave us an eye opener to make us understand that the code 19 means that the virus has been around since 2019. So it
Mm-hmm.
came into Nigeria 2020 and give or take, we are all in it right now. No,
Mm-hmm.
even from the little to the big, old, small, everybody knows what coronavirus really means. But let me tell you, some people still believe this is a scam. Is COVID-19 real?
COVID-19 is real. I feel like the reason why people think this is a scam, if you look at the population of Nigeria, the population of, no, let me say Nigeria, let me say on underdeveloped country. If you look at the rate of poverty in such country, including Nigeria, it makes you want to believe that COVID-19 is not real. It makes you want to believe that the government are just doing something one more time to keep the vulnerables at home so they won't have anywhere to go, they won't have anything to eat, and just make them stay home, have control over them. That's why these people are saying that COVID-19 is not real. COVID-19 is real. You will only know that it's real if this affects any of your family member, maybe your mom, your dad, someone you love, and they die from it. From it, this is how you would know that this is real. For as long as you have been kept home, for as long as you are not being allowed to move on with your daily life activity. Majority of people in an underdeveloped country, they have to go out to fetch for bread. They have to basically leave their own house, leave their own home before they can eat in a day. So for as long as that is still going on, for as long as that is still happening, it's going to be hard for these people to believe that COVID-19 is real, except a change is made.
Now, Bukola, yesterday we had Dr. Sheikh, on Saturday, sorry, we had Dr. Sheikh Mali on the show.
Mm-hmm.
And I asked him one question, and I want to ask you, is this virus as deadly as what it has been introduced to us? Because the hype around the virus is so much that people still find it difficult to believe that. Why don't you say people shouldn't gather? Is it when Ebola came into town, it wasn't like this? So is this virus as deadly as the way it is being presented to the general public?
The virus is as deadly as it has been presented to the public. If you've ever had pneumonia before, if you know someone who's had pneumonia before, pneumonia affects your lungs. The moment you get infected with a pneumonic virus, your lungs start shutting down if care is not taken. So this virus is in the same family as the pneumonia virus. And now coronavirus has been around for a long time. This is just a different strain of it that is being out there and killing people. This virus is as deadly as they're making it sound. They are not trying to make anything up. Now, the Ebola virus is just as the same. Anything virusable, anything that is virus, anything that is tied to a named virus, is just as deadly as the name sounds. Virus kills you faster than bacteria, and people are not believing it. I don't understand why, and I don't even understand why they're comparing this to Ebola virus. Ebola virus was just as deadly as this one, and for people to not believe that this is not as deadly, or they think the governments are just exaggerating, I do not understand. Like I said again, until you get coronavirus, until you get infected. Actually, you know what? I've actually had co-workers, two of them, who are infected with the virus right now, and I think the benefit of the reason why they are still at home quarantine being quarantined at home is because they are young and they don't really have any other health complication issues going on with them. This thing is killing mostly elderly people. For young, healthy adults, it will be very hard for this virus to kill you, except you have other health complication going on with you. So this virus is deadly. Until you get infected with it, you won't know. So maybe some people should just go ahead and try to infect themselves and see how deadly it is.
When you say some people should just go ahead and try to infect
I
themselves.
mean,
Now,
try to infect yourself and see how deadly it is, and maybe you will start believing that the virus is deadly.
let me now ask one funny questions that you hear around town. Yeah, when you see some people should just try and go and infect themselves. There's this gist like, do you know anybody that know anybody that virus? Why did they say that every day there is this number, there is this figure of infected people and discharged, death, and all that? Then people are like, where do they get these numbers from?
the the thing is, for every diseases out there, and I'm speaking from a little information that I know, and from also taking classes, microbiology classes, and also being working in the health field, and from that knowledge side, for every diseases out there, for everything out there that can kill you, that can affect your health and kill you, people those who goes to the hospital to get treated, this is where these numbers are coming from. There are people who actually collect data on how much patient, or how many patients comes in the hospital to get admitted, or admitted on any kind of disease. It might be, it could be malaria, it could be COVID-19, it could be anything that is actually deadly bacteria or virus. For every patient who is admitted to the hospital to get treated for such thing, for such deadly killing disease, their data is being collected, because when you go into the hospital, your name is registered as a patient with such disease, as a patient with such symptoms and such signs and symptoms. And when you die, your name is in the database as a patient who died from something like this, who died from something like that. This is where all these numbers are coming from. Now, majority of us are not even going to the hospital to put ourselves out there and say, oh, I feel sick and I just wanted to treat me. Majority are now taking powers into their own hands, treatment to their own hands, and treating themselves at home. So until you actually go to the hospital, until a doctor attend to you and tell you this is what is going on with you, the numbers on the data will continue to rise. So I think that's just where that is coming from. Is people going to the hospital, getting tested, getting treated. This is where these numbers are coming from.
Now, Adebukola, that actually means you guys over there are doing a lot of testing. What's it like? Is it like everybody's being tested for this virus, or you just decide to come on your own when you want to, or it is mandated that everybody must come out for testing?
Not really, but as of some days ago, my hospital, my job, they not even some days ago, from the beginning of this virus, they've had a walk-in shop or a workshop, something like that, that a walking clinic that you can go in as an healthcare employee and get tested for this virus. Now, if you're just an ordinary person, you can you can release yourself to be a study for the virus, if you want to. But until you actually do feel sick, until you actually do feel like something is wrong with me, as just as an individual which is out there, a normal person, until then, that's when you actually go get tested. Till then, they are not allowing or encouraging you to go get tested, because what is the point of wasting a test if you don't feel sick? So you have to feel sick as an individual before you can get tested. Except if you are an healthcare employee, you can go ahead and get tested and see if you've been exposed to the virus, which I've been thinking about doing myself, but I just haven't had the courage to go. My husband has been tested at his job because he's also a healthcare worker, and the test was brought into his job and everybody got tested. So it depends on where you are, what you do for a living. Aside all of that, if you're a truck driver or you sell biscuits on the side of the road, until you get sick, no one is going to test you.
Okay, so well, you said you've not been tested, but you are on the front line. No, well, anyway, that's fine. But
I
let me
am on
ask.
the front line. I'm on the front line. I'm scared of going to get tested. I feel it's going to be a negative. Majority it's going to be hard for you to be positive because coronavirus can be in your system for that long. I mean, so there are some young people not showing symptoms, but there will be something that's gonna is probably gonna run a fever, start coughing, but none of that's going on with me, you know. But we've been advised to go get tested at the job. It's not mandatory, but they've advised us if you feel like you want to get tested, go ahead and get tested. It's all for the old precaution. The only thing they're going to do is the worst part of it, probably going to quarantine for 14 days, and that's it.
Now, the figure from United States, the number of coronavirus cases that you guys have over there is about 2,655,955. That's a lot of people.
It is a
And
lot of
number
people.
of deaths,
And three, yeah.
565. And I was checking Georgia. I know that's your city. I hope I'm right.
Yeah.
Georgia is about 1,700 and something.
Yeah, Georgia is not on the rise like other states. Now, Florida is going crazy, and I was just talking about it yesterday too. Like, Florida is on the line right now, and I think the reason why that is because their governor went ahead and opened the state way too early, including Georgia. But now look at it. Florida is a very nice state. I mean, I had a vacation plan to go to Florida from the beginning of the year, January. Yes, Florida is like this. It's like this not so rich, not so poor kind of vacation where they have beaches, they have nice hotel that you can go lodge yourself in and make it look like you are living you are living large, you are living in Europe or something like that. So if you've been quarantined from the beginning of the year and you hear that Florida is open, what you going down there? So that is and it's so anyone can drive to Florida depending on how far you live. Florida is 5 hours away from me, and New York is probably not that far from Florida. I don't know. So New York is the most impacted, and people have been home. So the moment they heard that Florida is open, what? Everyone is traveling to Florida. I think that was what happened. The reason why the numbers are so high, and Georgia seems to be rising back up a little bit because as of I think maybe April or May, my hospital actually was seeing less coronavirus patients had been admitted. I can remember when they were giving us reports and we only had like 9 patients as of a couple of months ago, but now the numbers are rising back up again just because people are traveling, people are leaving the state to go to another state, and it's summertime. We don't get summertime all the time. We live in a very, very cold country. So the little warmth that we get during the course of the year, we want to make the best out of it, which means you want to travel to another state, if not another country. And I think that is what's going on. People who are stressed, people who are tired of being home, and they're just traveling to the next state.
Talking about traveling and the phobias around this virus. Here in Lagos, there's this verified news that people have stopped going to the hospital because of panic. They just don't want their name or their number to be added to that figure. I don't know, is the same thing happening over there?
It is. Nobody wants to be a statistic for sure, and we were actually talking about that because at one point in my job where I work at, they started reducing the amount of people that comes to work, which means which means if 4 people are scheduled to work, they're going to reduce it to 2 people because we were receiving less patients, and the reason is because of what you just said. People are not coming to people. People actually believe that the hospital are the one infecting patients with these diseases. Like if you come in,
Yes.
if you come in on the symptom of, oh, I was just coughing and my chest started burning, my chest started hurting, I decided to come to the hospital, and you get tested, the next thing you know, oh, you have coronavirus. They're like, what? Like, they're not expecting that should be the outcome. Or like, why does every coughing, every sneezing, every chest pain should be or could be coronavirus? Why can't it be something else? Why can't it be the cold? Why can't it be something that's that has actually been in existence. Why does it have to be this new virus? So people are taking powers into their own hands to stay home and treat themselves. So you won't, because they believe that the virus is more from the hospital. The moment you step into an hospital, you get it. And it's actually sort of kind of true, because when we admit patients sometimes, the vulnerable ones, they come in on a different thing, and the next thing you know, when they leave, they're coming back and testing positive for the virus. So it's possible for you to get the virus in the hospital, because your health is more vulnerable to the virus, and there's no lie around that. But the reason why people are staying home and being treated or treating yourself, I don't understand. If you feel sick, go to the hospital. Don't even think about getting the virus. Just go to the hospital and get treated.
You know, when you said when they sneeze and all, but we do sneeze before.
Yeah, we do.
No,
We do.
and nobody suspects you. But anywhere you are now, if you just try and sneeze, they will look at you like, "Ah, are you okay?"
Yeah, it is true. It is true, because I'm allergic to the dust. I'm allergic to dust. I'm allergic to many things right now living in this country. Like anything makes me sneeze. So the moment I start sneezing now at my job, the next thing you know, somebody's looking at you, giving you the side eye, looking at you like, what is wrong with this
Yeah.
person? but but they are missing the point. They are missing the point. Sneezing is not part of coronavirus. If you do have coronavirus, you would not be sneezing. You will be running temperature, having difficulty breathing, and other internal respiratory problem aside sneezing. Anyone can sneeze. Anything can make you sneeze, and
Are
not
you
coronavirus.
this one you are saying is a new one. Oh. You mean sneezing is not part of it. But anybody
Sneeze.
should have sneeze, yes, it's not there.
People are just exaggerating, because this is serious. It might be funny, the way people are making it. People makes it funny to ease the tension, to ease the stress of the virus. That's why people are trying to make things, some things to be funny. But to be real, on a realistic note, sneezing is not part of the symptoms. I think coughing, difficulty breathing, temperature, diarrhea, some stomach pain, those are the symptoms, and not sneezing. Sneezing is not a problem. People just want to exaggerate every time you sneeze.
That's serious. Anyway, because you're talking about how it has actually affected the health system. In this part of the world, the kind of models that were admitted for tackling this pandemic, most especially in Lagos, is that they will go into spacious places like stadium to build tents and convert those tents to isolation centers and all that. And some other cities, instead of them doing that in Nigeria, they will actually improve their health system, hospitals, they renovate it and all that, and make it look more conducive. What kind of method do you guys do over there? Do you do the same? You go to the NBA court, one of the stadiums, basketball court, and build isolation centers there, or is the same health system that you use for it?
Yeah, we haven't been to that stage yet, just because right before coronavirus, the health system here is really, really great. And at my job, the one thing that they did was converted a particular floor that is assigned to something else before, and they just converted those two, well, actually, just two floors. Converted those two floors to isolate coronavirus patients. Even in ICU now has been converted to treating coronavirus patients. And if you come in on a complication of being admitted into an intensive care unit, they've designed is a particular space for ICU patients without coronavirus to be treated. They are trying to make the best out of this what we already have, and open, not to have something new. Now Texas is rising right now, and it was on the news some days ago that the Children's Hospital are now admitting coronavirus patients, because the hospitals are running out of space, out of beds, and out of rooms. Yes, this can happen. They can happen if you get to a point of we have to start building something new. But for the state that I live in, we haven't got to that stage yet, except for maybe transforming already old units into corona isolation rooms for patients.
Okay, that's fine. Now that means my own concern is that if with your numbers, with that increased the kind of numbers we are seeing from the United States in millions. You guys still manage it, not like a pandemic in court. Take those guys away from the city and put them somewhere.
It is a pandemic because it's all over the world, and the reason why we are able to manage it is because this is a developed country. You can't imagine a country, a continent like Africa, to have such numbers. The whole Africa is going to vanish. Anything Africa continent is. We are just going to. I can't imagine us having such numbers. Okay, it's going to be a disaster. The reason why we are able to manage it is because this is a well-developed country, and I feel like Nigeria, as of today, when I go on the news and to read about what's going on, I feel like they are trying their best to isolate this virus the best way they can, and I feel they are doing an okay job, if not a great job. Your surviving rate does not depend on the doctor. It's not determined by the doctor or what the doctor knows how to do or don't know how to do. Your surviving rate depends on your body, how your body reacts to something, and of course, God is involved. So if you die from coronavirus, not necessarily means that the doctor didn't do their job or they didn't have the necessary treatment. Actually, there's no cure for virus. Your body has to fight it. So it depends on your own self, how your own self is going to help you live from or get cure from this virus.
Yesterday on Saturday when we were talking to Dr. Shegun Ali, he was actually mentioning some points, like referring to sitting on the improved health system and all that. There's this impression that over there, you guys have wonderful health system that has been able to up their game to manage this pandemic. But here in Africa, like you said, and you're actually right, our system somehow does not really have that strength to manage if this thing is actually a pandemic here. If it's a real pandemic here,
we don't have the system back home, and I can't imagine us having the system back home. Congo, where this Ebola virus started, when Ebola virus started, Congo is one of the most poorest country in Africa. And as of some days ago, they celebrated their last patient Ebola virus infected that didn't die or something like that, if my reading was right. I can't imagine us going through this. The whole of Africa, the whole countries in Africa that make Africa a continent. I can't imagine us going through such thing. There won't be any Africa anymore. We are going to be wiped out because our system is not developed like that. We don't have a strong health system, whereas in the developed country, you get treated before you get paid. You get treated before you can pay. This is how great this health system is here. When you're sick, we take care of you first of all before we start asking you for money. Back home, if you don't have money, your chance of dying is really, really high. Except you're rich, except you have money. That's the only way you can survive. And even with that, sometimes you can't even survive because they don't have the necessary equipment for people who are actually terminally ill. So everything has its own, side to why we cannot be infected with this virus more than what we actually have right now.
Bukky, you are right. Like you're very right. Now let me take this conversation to a more deeper aspect around this improvement and system that works. Now we are meant to know, like when we're talking to Dr. Shiman, that over there, you health workers are being celebrated. There is this kind of unique treatment that you guys have. But here in Africa, there's this complaint. We got this fact from Dr. Shegun about allowances. There's this PPE that they complain about, and there's why? How is it over there? Is it that just let us into it? He said immediately when the pandemic came in, there was a revampment of the health system there. The health worker were giving like 100% of what, I don't know. I wanted to just verify his point.
I mean, it is. He's right. He's doing his research, so he's right. Over here, we are being celebrated in a different way. Actually, you know what? When the quarantine just started, we had companies like Starbucks. We had companies like, I can't remember anymore, some food company anyway, that caters to us for free. Like they bring food to us every, was it twice in a week or 3 times in a week, lunch and dinner. They bring in sandwiches, they bring in rice and chicken for us to eat. And I remember always looking forward to, when are they bringing us food to eat? You know, yeah. So yeah, they are treating us nicely, and the money aspect, the payment aspect. I remember when my hospital opened designated a particular floor just for coronavirus patients, which they still have it. Where every time you are sent down there to go and take care of a patient, a nurse, a doctor, a tech, whoever you are, for as long as you've been sent down there to go and take care of someone, putting your life on the line for someone who's not even your family member. For every time you go, they pay you $3 or $4 extra on
Wow.
every hour plus your normal rate plus your normal salary. So they pay you every $3 on every hours that you are on that floor treating these people. So he's right. When I read, when I go on Linda Ikeji and I see the doctors just walking or protesting because for the sake of they're not being paid, it pains me. It kills my heart that doctors are not being treated the way they need to be treated. Like without doctors, without nurses, your sick family member, they are not, who's going to take care of them? Who's going to make sure that, I mean, majority of people who actually do have sick members, family members, they can't even take care of them. They don't want to take care of them because the burden is too much. You see, I said I'm tired because I am tired. working a 12-hour shift, taking care of a sick patient who's not my family member, and making sure that everything goes well with them, for them, so you don't get in trouble. It's a really big commitment. It takes a special person to be able to say, I want to go and be a nurse, or I want to go be a tech, or I want to go be a doctor and take care of people. So I don't understand why these doctors and nurses has to protest for them to get something that they automatically deserve to be given to. I don't understand. Like I was just still asking my job the other day. I'm like, are we still getting paid from this money? Anyway, my job stopped it because this pandemic affected my job, my hospital, and we are actually in debt right now. We are in debt for $160 something million. So they are cutting people off. They are firing people. They are firing executives. Because we stopped accepting surgery, we stopped admitting people who actually were scheduled for elective surgery since the pandemic started, and started taking care of people with viruses, which means that if you don't have a job, if you don't have health insurance, and you have this virus, you have to be treated so you can leave. We can just not treat you because you don't have insurance. So it kind of put my company into debt. So now they are telling managers to take 1 week off, 2 weeks off from the job without pay, so they can revamp and start getting their money back. So yeah, so this is real. People are getting into the companies are going into debt and firing people, but your doctors and your nurses should not be impacted by this, by not being treated. They need to be treated fairly. That's just it.
Adebukola, it's so painful, but our society, the system that we operate here is bad, and that's why we are into this space. But let me shock you. It's not as if these guys do not actually have funds that they put on paper on national TV to say, okay, this is the amount of money we are spending on this virus and all that. But still, the guys who are on the front line doing this work, that they are getting this, the politicians are getting this money for, are not being paid. Anyway, this will actually lead me to my next question, but let me just take this brief. I want to thank you for your time. We've passed a mark of 30 minutes, and I want to appreciate everyone for being part of the show. The voice of the person you've been listening to is Bukky Dantis. She said she don't call her Mrs Adekanyisola. It's Bukky Dantis. She's talking to us from the United States, Georgia, and she has been a friend for a very long time, like many years down the line. And she's shining, and I want to encourage you all to join our blog. She will give us the handle for the end of the show. She's an online influencer, social media influencer.
I'm trying.
Yeah. All right, so let's go back to the show. And please, we've been having a lot of comments. You will react to it before before the end of the show. And I want to encourage you all as you watch it. Also, if you have any question to ask, send it to the comment button so that I'll be able to put it up and Bukky will react to it. Now, Bukky, let me ask. I was asking Dr. Segun Ali on Saturday that why are governments spending so much on this virus? The monies, the figures that you hear now is in billion. Is it that this virus is so expensive to manage?
It takes years to develop vaccines. It takes money to develop vaccines. So the billions that you're mentioning, they're right. Yeah. But the point is, are they really going to do what they say they would do? Like, would this billion just get disappeared? Would the snake walk into an office and swallow this billion?
And swallow it all.
Yeah, no. This is what people need to know. Like, okay, we understand virus developing vaccine, we need money anywhere in the world. Even in the US, they are budgeting billions because the researchers need to get paid. They need to buy equipment. They need to buy every necessary that is needed to develop this vaccine. So yeah, the billions number they're mentioning is right. The point is, are we going to see this vaccine? Are people going to get vaccinated? Is this vaccine going to be the real one or the fake one? Just because we live, my country is so painful that it sucks sometimes. I've been identified as a Nigerian in a foreign land. The moment they hear you, oh, you're Nigerian, oh, they automatically think you're a fraud. So the point is, are these people in charge of this money, are they going to use it for what it's actually meant for? And they won't come out again in like a month or two and say, oh, the snake has swallowed money, we can't find it. Nigeria is so it's painful. I don't know. I feel bad for my people. I don't know what to say.
It's Bukky. It's really painful. Yeah, like it's really painful. But me too. I don't know what to say. But don't worry. We'll get to buy.
It's painful. Mm-hmm.
Yeah, we'll get to buy. So let me allow you to react to some of the questions that we have online now. And then, okay, I'll be taking the first question from Israel. Israel said, despite all the precaution against it and all the medical attempts, even with all the COVID-19 seems not to reduce. Why? You guys say don't go out, use your face mask, this, that, but still, it's the figures still increase every day. What's happening?
You have to realize that healthy people like me and you probably have the virus and we don't know. And we go out there without our mask on and we start talking to your elderly brother, your elderly uncle, your elderly dad and mom, like you're passing the virus just for the sake because you're not showing symptoms, but you're passing something on to them because they are vulnerable to the virus. So the reason why they're telling us to wear masks is to protect. If you do have the virus and you're not showing any symptoms, the mask protects you from passing it and giving it to someone who is vulnerable to the virus. Now, some people, conspiracy theorists, they want to believe that the mask does not protect you from getting the virus. Maybe yes, maybe no, but the percentage of you not contacting or giving the virus to someone by wearing your mask reduces your chance of giving the virus to a person or even getting you yourself sick. So they are not saying that the virus is going to cure or prevent you or not prevent you from getting. They are saying that it reduces your chances of giving it to someone if you do have it and you're not showing symptoms, of giving it to someone who is vulnerable to the virus. That's why they're telling us to wear masks. But people don't want to listen. So I don't know. I'll say wear your mask. I wear my mask when I go out, and sometimes I do forget. Sometimes when I walk into the store, I'm like, oh God, my mask. I have to go back into my car because I don't want to use the sake of, because I'm young, I'm healthy, I don't have any health issues. That doesn't mean that I can't catch the virus. You can catch the virus. I might not die from the virus because I'm an healthy young individual, but I can also catch the virus, and that's why we need to wear our mask. Actually, you know what? Some stores in the state that I live in won't even allow you to come in without a mask on your face.
Yeah. The same thing here in Lagos. Some stores will not allow you in without the
Yeah.
mask.
So they are trying all the preventive measure that they can take to prevent this thing from getting out of control and wiping off the old people population in the world. People are. I mean, health officials. They are the best people on earth. They are the best people that God has
You guys are
assembled.
the best.
And
Yeah.
to us, it's just a matter of knowledge. They are not saying if you wear it, well, you're going to get cured. No, they are trying to prevent it, and from you and I to getting more people sick. That's why they say just put your mask on. I don't think it's that hard. Put your mask on, and if you feel like you can't breathe, you can take it off and take a breather, then put it back on. Just protect yourself.
Anyway, the symptoms, as in the prevention methods, like don't put on your mask, and it's not actually going to heal, but it's just trying to reduce the spread. That's what you
Reduce,
say,
yes,
right?
yes, reduce the spread.
Okay.
Yeah,
So let's
yeah.
take this other question from Ifeoluwa. Ifeoluwa said, my question is that is it true? Is it true that anyone that have this virus, even when later negative, that person already is going to have lung disease?
Excuse me. Yes, you can develop. Study has shown that you can end up developing some lung issues, some lung diseases after you've been infected with the virus, but that doesn't necessarily means that that is what is going to kill you. You might have a lung disease that is actually might be treatable in the long run. You know, and maybe might make you more vulnerable to more other viruses out there, but that doesn't mean that this disease was going to kill you. I mean, the virus stays, any virus, any person who's been infected with any kind of virus, the virus stays latent in your body, which means that the virus is in your body as long as you do not stress yourself. You are not doing something that's going to stress you out for this virus to show up again. I don't know if you've read about people who have been positive before, treated before, then come back and testing positive again. That is because that's what viruses do.
Oh, I
They
don't
lay.
know that happens.
Oh yeah, yeah. That's what viruses do. They lay in your body and stay latent for years. Now, if with the moment you start stressing out, the moment you get sick with something else, your body goes into this defense mode, trying to fight something off, then bringing out something else. So that's just the way virus works.
Wow, this is this is new. I never knew that will happen, But anyways, but does that really mean they get themselves when they get themselves exposed again to the virus, they will go back
So now,
and
if you get exposed to the virus again, your chance of surviving is actually high because we have something called passive immunity, which means that if you already have the virus in your body and you get
okay.
infected next time, your chances of surviving is high because the virus is already in your body, so you're not going to die or get sick that much sick from the virus. It's just like the chickenpox virus. If you we were growing up, if you've ever had the chickenpox virus when you were growing up, like I did, your chances, the virus is in your body. You have chickenpox virus right now in your system, living in your body, like waking up and sleeping with you every day. But yeah, but the moment you stress yourself, or let's say you walk into a household with infected people with chickenpox, you're not going to get it because you already have the virus living inside of you. So you're not going to get the virus. You're not going to get sick from them because you're already a carrier of the virus. Same thing with this coronavirus, just with the rates is going.
Wow, Bukky, it's been a very long time. And I actually promise you we may not really stay long, but we've clocked the mark of 43 minutes. So we need to start. Let me allow you guys. Okay. So now, now this has been a few questions I would like to address before we end the show. The virus has come to stay. At least now in Nigeria, the virus is about 4 months, from sometimes around February ending and March to now. And schools are beginning. There is this conversation that schools will come back up and all that. And I want to know, how are you guys preparing for coronavirus season? Is the school coming up again and everybody coming back to normal life?
I think they are trying to reopen schools back up, but it depends on the county that you live in, the local government that you live in. So it depends on your local government officials to determine that for you. But they are trying to open up the school. But I don't have a child who's in school. people who have children who are in school, they are telling me that it's going to be an online course. So even if you're a college student, the classes for this semester are going to be online, except if your local government councils are saying that, oh no, this is not going to happen. Everybody has to go back to school.
Use county.
County. So county is like local government. We say local government back in Nigeria. We say county.
Use county.
Yeah, county. Yeah. So it depends on your county. Depend on what plans they have for you, and if they're enforcing that everybody has to come to class, they are putting things down like a barricade between you and another student, so you don't. But which I feel like is not a very good measure. But they are doing what they can. But I have a feeling that when August comes, that's when the next semester is going to start. Classes are going to be online because no parent and no adult is going to go and start teaching or learning in this virus. People are not that stupid, okay? No one is going to class. The class are going to be empty.
The society, our mindset itself, people are afraid, and going back to be in a place where there will be a large number of people. Everyone's going to be careful one way or the other.
I mean, if you do have, there are some courses that you have to be in class. If you're a college student, a university student, there are some classes that you just have to be in class. Like if you have to take a lab, if you're a medical student, you just have to be in class. So you just wear your mask and be in class. That's just it. You won't have any choice.
Okay, so my second question is this: like, how long is this virus staying? When is it going to go?
They are predicting next year, I think middle of next year, but we live in a very cold country. So as around the same time, people get sick from the common cold. So it's going to be a long time for this virus to be officially out of be sent back to wherever it comes from or it came from. So I can't really say this is when this virus is going to go away, but they are predicting next year, I think, because there will be vaccination on point, in charge, and people can start getting vaccinated. Until then, I can't tell.
Wow. So I want to sincerely appreciate you for your time. And why are you guys not looking at the traditional medicine, like the African medicine, the one from Madagascar?
Do you really want to go there? Do you really want to go there? Like, see, I so much love. Sometimes I so much love the European system just because I mean, come on now. You do you really want to go to Madagascar? Everything in the US, every medicine in the US is FDA approved. Just like we have NAFDAC in Nigeria. But NAFDAC in Nigeria don't even do their job. But the FDA is here, they do their job. Unless it's proven to treat coronavirus, they are not going traditional. No one. This is not.
But there are agencies in Madagascar that actually approve that too.
Yeah, that's for Madagascar. This is not for the US. Even chloroquine that they say is supposed to treat this virus. People are not. The FDA is not approving it. It has to be FDA approved. They have to make sure that this is not going to kill us. This is not going to affect us in more other bad ways, just for the benefits of the people. So no, forget traditional way in the US.
All right. So before I actually let you go, there was this conversation in town, like during that Black Lives Matter protest and all that. Was it that coronavirus was on break?
Coronavirus was not on break, but people who are passionate about Black Lives Matter were prepared to put their own lives on the line, and I applaud them for that, because I just couldn't be out there. I couldn't do it, and I think that's one of the reasons why we have a rise right now in Florida, in Texas, in Georgia, coming back up, because people were out there, and I applaud them.
You mean because of that protest in Minneapolis?
And you crowded people. I'm sure among those people there will be a sick person who is supposed to stay home, who choose not to stay home but be out there and be intentionally to want to infect people with the virus. So I think that's one of the reasons why there's a rise in the virus right now in the state. And those people, I applaud them for putting their life out there, protesting against something that's actually a great cause.
Wow, that's a big one. We actually have appreciated them here too. I follow the news back to back every time to check what's happening over there. And I actually wish you two a very safe environment. Hope you are good.
Thank you.
Seeing you and the police brutality and all. Is it real? Like the way we see
it is real. Like I don't know what there was there. I went to Texas at the beginning of the month. On our way back, we were actually stopped by the police. It was around maybe 12 p.m. or 11 p.m. at night. We were actually stopped by the police, and his accusation was actually uncalled. I mean, doesn't even make sense. He said my husband was swerving. He swerved to this lane and that lane. He was changing lane back and forth. Now, when you're a driver in the US, where police have so much power, they automatically just disorient your stability. You start acting somehow just for seeing them alone, seeing their car alone.
Okay.
Yeah. I think that was what happened that night. Why my husband was going from one lane to another. But anyway, he gave us a ticket. He gave us a warning ticket saying this is a warning. My husband was just like, okay, thank you, sir. Me, I've always said one thing. If you're stopped by the police here in the US, which I've been stopped before for traffic violation, do not argue with them. If they ask you to get something, tell them I have my they ask for your ID card or your driver's license, tell them it's in my purse, it's in my gloves compartment. Can I go ahead and take it now? Like, talk to them like a normal person. Don't argue with them. If they say you are guilty, you are guilty until you go to the courthouse, until the judge say you are not guilty. Just for the fact that somebody has a gun, even if they're not police officers, the fact that somebody has a gun on them make them more powerful than you. Until the gun is being taken away, till then they are more powerful than you.
Wow, and that advice is for more of your friends about it, because police will not shoot you.
Yeah, I mean, police brutality is everywhere. I see it when Nigeria too. I see how they treat all these people called SARS, whatever they call them.
Yeah,
I think the majority, the main problem of these people, so-called police and SARS in Nigeria, is the lack of education. They hire these people and lack of training. They hire these people without any moral training, without any education background, and put them in the force. You go to police academy for what? 3 months, 4 months, treat them. So they are actually putting out there what they've been taught in their academy, because no normal person who has been taught the right way want to go out there and start behaving. Yes, some of them go out there and start misbehaving, but until the Nigerian police force can put together a well-developed training and technique for these police officers, these people will always behave irrationally. I start hiring people with common education background. Somebody who actually went to secondary school and graduated. Somebody who actually do have HND or OND. Somebody with a common education background. Until they start hiring those people, training them and paying them good salary, and letting them know that this is the right of a citizen. This is what you're supposed to say. You're supposed to treat them. Until then, these people will continue to act crazy. So when somebody has a gun here, Nigeria, Africa, as long as somebody has a gun and they are talking to you, they have more power than you.
Yeah, that gun is called respect.
Yeah.
Yeah. So Bukky, I want to appreciate you for your time. You've taken like an hour, it's almost an hour now, and you've done justice to all the questions, even from our viewers. A lot of them, and few of them sending me comments and all that. And before I actually let you go, I made mention of your blog. Can you say something about your blog on my show?
I have a personal blog that I blog about personal lifestyle. It's not really that big of a deal, but it's a blog that is actually out there for the public, where I talk about what life has taught me, what I'm going through, just basically lifestyle in general. And it's www.bookyblogspot.com and www.booky as in dog blogspot.com. I haven't posted in a while. I'll try to work on that because I'm always busy. Aside that, they can follow me on my YouTube channel at Bukky Dantis. My YouTube channel is more current and up to date because I'm always blogging, I'm posting, so they can follow me on my YouTube channel.
Okay, so before I let you go, what's your final word on this coronavirus pandemic? But I say to general, do you say we should not fear again, or we should just keep praying? What's your
Yeah, we
final
have
word?
to live a normal life. Don't live your life in fear. If you live your life in fear, that's actually what something is going to happen. Live a normal life. Pray. Don't live your life in fear. Wash your hands. If you feel sick, stay home. Don't go anywhere. And if you feel very extremely sick, make sure you go see your doctor and get treated.
Wow, thank you so much. Thank you, Bukky. Thank you for coming around
Thank you for
to
having
part of
me.
our show today. Make sure you rest very well so that you'll be fresh
Of
for
course, I'm
tomorrow.
going back to sleep.
Have a wonderful night. Take
Thank
care.
you. You have a good day. Bye.
Bye.
Bye. Bye.
Bye. Yeah, so that's Bukky, and this is the second part of our show on Let's Make of Fair of Official Fair TV. I want to appreciate everyone for being part of the show. It's been a long one, a very long one. Thank you so much. I want to promise you we'll be coming up with more detailed issue-based programs that will impact our life, that will change our society. We want to appreciate our guest today, Bukky Dantis, joining us from Georgia. And it's been a very busy day for her, and she took her time out to be part of the show. I want to appreciate everybody for joining online. I really want to, especially want to appreciate all those who send in their comments. And I used to say this every time. Send in comments like I mentioned your name. I want to appreciate the fair love. Fair love is one of our regular. And my friend Israel who have been here. And Omotayo Evelyn. Wow, Omotayo Evelyn just sent a question to Bukky has got. So thank you so much. I want to appreciate you. Don't worry. Let's talk. We'll be back again with you in another 4 or 5 days, and we'll be introducing the topic to you online. Please, I want you all to please like our page, subscribe to our YouTube channel at OFE TV, on Facebook at OFE TV, on YouTube, and on Instagram at Official OFE TV. I want to wish you all a very safe environment, a wonderful day ahead as we going through the many days in the month of June. I want to wish you all a wonderful second half of the year 2020. Please stay safe and take good care of yourself. My name is Oladokun Femi Manuel, and all I will say to you is OFE kids. Thank you so much.